right to left or left to right. I don't know.
Okay. My name is Vince Luzio, and I'm here to give you some more insights about kidneys and foundations, and my daughter was a patient also at the Children's Hospital in the Royal Melbourne, and she passed away last year in October.
I'm Veronica, Louie's mum, and I'm just here to help raise awareness. I donated to Louie 4 years ago, so hopefully I can help answer some questions if need be.
I'm Grant, and I've had 2 kidney transplants a few years ago now, and I currently do dialysis 3 times a week, so I'm here to hopefully help out about some questions about kidney transplants and why organ donation is so important.
I'm Louis Hare, and an opt-out policy campaigner, and just raising awareness about organ donation.
What if technology fails, someone hacks into the list of people who have opted out? Why is this the end of life? Whoever the individual's next of kin is are asked if they wish their loved ones to be an organ donor.
So from my understanding, with the opt-out policy, especially under the current system, the family would always be asked if they wish to respect their loved one's wishes. And I know from speaking to Zadie's Rainbow that this would still be the case under the opt-out policy.
What legal implications would arise if a mistake was made? Would it become a human rights issue? In Australia, due to the code of ethics that hospitals and surgeons operate under, the next of kin will still be consulted about whether they wish to respect their loved one's decisions.
Yeah, so basically, as I said in that answer previously on a couple of my articles, we would still respect the loved one's decision. I had a caller come in on the ABC radio on Wednesday saying he wouldn't want to be asked under the situation of just finding out in ICU. That's why we're trying to raise more awareness prior to that situation coming to fruition.
What if ill-informed people do not understand what they are on a list for?
Yep. So this is why education is key. I spoke to the healthcare minister last year and have been speaking to Kidney Health and Transplant Australia and the Royal Children's. We all believe that we should educate people about organ and tissue donation.
How would you opt out?
So at the moment, to sign up, we go online through Donate Life. And through speaking to Donate Life, I believe that this would be a similar procedure.
Is it not better to advertise organ donations more instead of assuming everyone agrees with the policy of opting out?
Do you want to take this one, Mike?
Well, with opt-out, even if you don't do it formally, your loved ones still have the final decision. So I guess it's about the numbers we would hope would be higher if it was assumed that everybody was a donor rather than having to sign up. So in other countries that has increased organ donation, so that would be the goal with that.
Yeah. Mr. Rubin, have any questions?
No, I have one.
Yep.
Are there any possibilities that if someone was to die of cancer of some sort, that their organs could be dangerous to whoever they're donating to?
I can probably answer this one because we talked about that the other day on the radio, and so it's a case-by-case situation. So some people that die from cancer, their organs can be donated, some can't, and that would be looked into and decided at the time. Certain cancers, if they're not ones that spread to different organs, can still be, people can still donate. So it's always worthwhile still signing up what's happening, and people also worry they might be too old to donate, but that's the case. Did you want to add to that, Ken?
No, just that was right. The idea here is to help the community understand how these children go through this. The organ donation is still extremely low for a beautiful country like Australia. So we expect you to try to understand what these children go through, and donation. There's a lot of I know Grant works for the kidney organisation. He's always constantly just making sure that everybody understands what this organ donation is all about. And what we need is more, that, like Louis was saying, more about the education side, that we all do understand that. I know the guys have got, they have dialysis 3 times a week, as Grant just mentioned, but that is just to keep them alive. We've had experiences, all our families have had experience about waiting for donors and having the right kidney donations, but we need to be extremely loud in what we're saying in terms of making sure that everybody do understand that this is you don't want to become a machine like Grant is, just on a machine 3-4 times a week, because it's not a real quality of life. So I would think and consider or ask more questions in terms of what is this kidney foundation and organ donation is all about.
And I think the big thing is that with an opt-out system, it's not you die and people take your organs. It's still you need consent from the family to do it. So it's not you just passing away and then people taking your organs. You can still choose not to have it happen even if you haven't opted out. It's just the question is asked whether you have, whether you're opted in or not. Yeah.
So it's called a soft opt-out, isn't it?
Yeah.
So it's not, the family is still always approached, obviously. That's still, whereas I think that's where people get confused with opt-out. They think that it means someone signs that bit of, doesn't opt out, that's it, they pass away, and, then that's going to be an insensitive time, and it's not like that at all. Yeah, that's probably the biggest thing people need to know about it, is it's still, if the family doesn't want to go ahead, it doesn't go ahead. And that's perfectly fine.
So some of the world's top leading organ donation rates countries are in opt-out. Why do you think that the current parliament doesn't want to follow their lead?
So I spoke to the aged care minister last year. He feels that amongst our Indigenous population, the literacy rates are too low. Some people
And that they wouldn't know what
they wouldn't know what they were signing and stuff along those lines. One other point that some people in opt-out policy countries have mentioned is they believe it's also the hospital system. I feel, as someone that has been in the hospital system for 18 years, that we have that standard in a first world country like Australia, and we have the medical procedures along with that. So I believe we have a national body. We have organisations who facilitate that process.
So what do you propose that the Australian government does in the next 10 years to boost organ donation rates?
I think there are 2 main things that can be done. One is more funding for stem cell research. I know one of the Royal Children's doctors, Kathy Quinlan, who's quite closely associated with this research. Mum went up last year, so this might also be a good topic for you to touch on. They're saying that within my lifetime, they'll probably have the opportunity to have stem cell organs transplanted.
But in terms of increasing the people signing up, I guess that's, it's a community. The community needs to get behind it and get involved, and it should be presented positively as well, which
Well, there are so many different type of donations, and I can't think of how many there is from cancer and the McGrath Foundation, and there is so many, and I just think sometimes the Kidneys Foundation side of it probably gets lost in the middle of all that, and hence why you got Louis really knocking on people's doors and government doors and saying, listen, we need some more exposure to this long life illness. So I just think that sort of it gets lost. It probably needs to get up a bit higher and get more people to understand how deadly this disease is.
I think kidneys are one of those tricky things because there is a treatment for it. So I go to dialysis 3 times a week and I feel fine. So people don't realise the impact it has on my life. They think, oh yeah, you're getting a treatment, so you're getting better. Whereas the treatment is keeping me alive, and a transplant is the best treatment that there is to stop me from having dialysis. So people don't understand that I'm still sick even though I'm not in hospital. I think with a lot of chronic conditions, that's the same as well. It's that, oh, you know, you're out there doing stuff and you don't look sick and it's not affecting you, whereas they don't, you know, they think, oh, you just go to hospital to get better. So I think that's the thing with kidneys. People don't understand that actually the impact it has. So a transplant actually improves the quality of life of someone. You know, it takes away my dialysis time, which is 12 hours a week in hospital that I could be, you know, living life. So a transplant improves the quality of life so much more.
And independence too, isn't it?
Yeah.
Like, you know, you can't just decide to go on a holiday
Yeah, exactly.
to Queensland without huge amounts of preparation like you guys did with Yana. Like, it's a big deal to just go away for the 4 days. It's not just, it's a big deal. You've got to organise.
Just to give an example, just to go to Queensland, you have to you've got to find the right hospital in Queensland or wherever you're staying. So the patient can have dialysis like 4 hours a day. So you know, the quality of life, but you know, half your day's gone. But I just feel sometimes, you know, the years gone by. I mean, I've lived this for 21 years since my daughter passed away last year. That I think people just think that there's a machine there, and that machine will keep them going tomorrow, and so on. But I don't think everybody really understands that. You know, Grant, I'm not sure how many. Can you drink a litre of water a day?
Yeah.
Just the poor guy can't drink a litre of water. That means coffee and tea, etc., etc.
Yeah.
So just to have restrictions on what you can eat and what you can't, and quality of life. But he knows that tomorrow he'll go into dialysis and have his 4 hours.
We've talked a lot about organs. Now, how does tissue donation work?
So I've done a little bit of background research through my work with Donate Life. The way they do it is similar. So I know from the age of sort of 16, you could register as an organ and tissue donor. So it's the same sort of process in that they ask the next of kin, whoever that may be, etc. And what's really interesting is, I'll go back to the example of cancer. Sometimes when the organs can't be donated, I know that the tissues can. So tissues like the bone marrow, and I'm trying to think what else. Sometimes the corneas can still be donated and give someone a fresh start in life in that they can see again. I know from speaking to Alan Turner, his daughter Zadie's corneas went to, I think, a 4-year-old who had eye condition since birth, and that 4-year-old was able to see again due to Zadie's gift.
So let's say the government gave you $1 million to try and boost organ donation rates. What would you do with it?
I'll go first. I think for me, I would put it towards research and education. I know Alan Turner is currently trying to get a nationwide education program going. I believe that if we can put more money into the education of organ and tissue donation, more people will register, especially in universities.
Yeah, education will probably be.
Yeah, and I think any money towards organ donation kind of has a roll-on effect as well, because if you put more money into organ donation and increase the donation rate, then someone like me who's on dialysis will not be on dialysis, and there is a waiting list for some dialysis units as well. So then, more money can be spent on dialysis because there's less patients on dialysis. So there's more focus for those who actually need it. So I think, you increase the organ donation rate, you kind of have a roll-on effect on the whole healthcare system.
I think it's a really good question that if we could get $1 million, thank you, if we could, because the revenue money that the guys raises from the Kidney Foundation, like Red Kidney Walks and rattling the tins and things like that, I'm not sure this is right, Louis, but does the government give any money to the kidney organisation?
Yeah, so I know this year, and Grant, I know you've been speaking a lot about this over the last couple of weeks. Through the last budget, the amount of money going to Indigenous patients who are on dialysis has greatly increased. And I think this is key to helping that part of the kidney transplant population.
Well, I think we're just about out of time, so thank you very much. I will edit this up and upload it tonight.
Thanks, Jed.
Thanks,
Thank you.